during this session, you will need to press star one on your telephone. And please be advised that today's conference is being recorded. And if you require any further assistance, you may press star zero. I would now like to hand the conference over to your speaker today, Mr. Mike Schomer.
Thank you for joining us for the COVID-19 media briefing for April 15th. We'll start today with opening comments from Health Commissioner Jan Malcolm and Infectious Disease Director Chris Gersman. We also have two guests joining us today, Jonathan Watson, CEO of the Minnesota Association of Community Health Centers, and Ann Niakundi, CEO of United Family Medicine in St. Paul. We'll then open it up for questions from reporters. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Around the world, we continue to add hundreds of thousands of new cases of COVID-19 each day, 820,000 added yesterday, and almost 3 million deaths worldwide, increasing still at the rate of over 10,000 a day. In the United States, we are still adding, as of yesterday, an additional 75,300 cases per day, and we're at now 564,405 deaths, an increase of just under 1,000 from the day prior. Here in Minnesota, we reported this morning 2,736 positive cases for a cumulative total of just under 550,000 total Minnesotans since the start of the pandemic. With the exception of the holiday weekend earlier this month, when we reported 2 days worth of cases in a single day, we have not seen a single day case count over 2,700 since late December and early January. Case counts on a population basis have been steadily increasing and are now more than 3 times the high risk threshold at 35 cases per 100,000 people. And this metric continues to grow in the data lag period. We've had 26,000 new cases so far in April. And we're still seeing the pattern emerging very similarly to what we saw in the November surge. Week over week growth is increasing, and we're hoping that we don't see that exponential, explosive rate of growth, but we're getting closer to it. The 2,736 new positive cases reported yesterday came on a testing volume of 46,409 lab tests. It's encouraging to see testing volume picking back up. We appreciate Minnesotans taking our advice to test more frequently and to test when you're doing a lot of socializing, kids in school, kids in activities, and for sure whenever you think you might possibly have been exposed, because we know how important testing is. It's one of our most important tools available to contain the spread of COVID-19 and to minimize the impacts on our communities and families. Certainly in addition to the hopeful news on the vaccine front, which we'll get to in a moment. There are currently just under 700 people in Minnesota hospitals being treated with COVID-19. Of those, 168 are in intensive care. This is up from 600 beds a week ago and up over 60% just since the beginning of this month. Cumulatively, there have been a total of 28,750 people requiring hospitalization. 7,875 have received intensive care. It's also notable that the age profile of people in the hospital has changed in this latest wave. The majority of new hospital admissions since we started seeing this uptick are now under the age of 60. Minnesota reported 11 additional COVID-19 deaths today, for a cumulative total of 6,989 Minnesotans lost to COVID-19 since the start of the pandemic. Sadly, we expect we're going to hit another very unfortunate milestone in the next couple of days, likely to hit 7,000 cumulative deaths soon. On the vaccine administration front, we continue to say that we really truly are in a race against time to get Minnesotans protected. Fortunately, we continue to make good progress on the vaccine rollout. Almost 3,470,000 total vaccine doses have been administered as of the last report shown on our dashboard. This is both first and second doses combined. The number of people with at least one vaccine dose is now over 2,160,000. almost 1.5 million people who've had the complete series of COVID vaccination. 48% of eligible Minnesotans have now had at least one dose, and 33% have had both doses. In the over 65 population, we're now over 84% with at least one dose, and well over 70%, 77%, I believe, for those with a full series, ranking fifth in the nation for the number of completely vaccinated or percentage of completely vaccinated people over the age of 65. With that, I'll pass it to Chris Erzman.
Thank you, Commissioner. I just want to underscore Commissioner Malcolm's comments about the challenge of getting as many Minnesotans vaccinated as quickly as possible while also trying to limit any surge in cases. We continue to get reports of COVID-19 cases associated with a wrestling tournament that was held in South Dakota at the beginning of the month. We're now at 29 cases impacting 13 schools around the state. As a mom of a former wrestler, I encourage anyone who attended the Northland Youth Wrestling Association State Wrestling Tournament in Sioux Falls from Wednesday, March 31st to Saturday, April 3rd to get tested and take the preventive steps necessary to avoid spreading infection in your schools and communities. We know everyone is so tired of this pandemic, and we are too. We can all end this faster if we hang in there a while longer and keep doing those things that we know work to limit transmission. So please continue to mask, limit exposure to people outside of your own household, stay home when you're sick, and for youth involved in sports and extracurricular activities, test weekly, in addition to our recommendation for those who attended this particular event. We want youth in sports and extracurricular activities to test on a regular basis. Then I just want to provide an update on the Johnson & Johnson vaccine. As you know, we sent out a message Tuesday advising health providers to follow the federal recommendation to pause the use of the Johnson & Johnson COVID-19 vaccine while CDC and FDA review information about an extremely rare type of blood clot reported in 6 of the nearly 7 million people who received the vaccine. CDC and FDA recommended the pause to allow time to assess the available information, to stimulate reporting of potential additional cases, and to prepare healthcare providers to recognize and diagnose patients and treat them appropriately. Yesterday, the CDC's Advisory Committee on Immunization Practices, or ACIP, met to review the available information. The committee did not make a specific recommendation, but agreed to spend the next days working with public health officials and healthcare providers to gather more information. The committee is expected to review that information again and to take steps next week. They're expected to meet on Thursday or Friday of next week. As we contemplate this news about the Johnson & Johnson vaccine and these rare but concerning adverse events, I think we need to keep in mind what Dr. Fauci said earlier this week, and that is the context of respective risk. If you look at the risks of COVID, 1 in 10 Americans have been infected with COVID, and 1 in 558 Americans infected with the disease have died. There's also estimates that about 10% of COVID-19 patients go on to become long haulers, according to a recent article from the Journal of the American Medical Association, based on a study done by British scientists. So we want to keep in mind that as a disease, COVID is something that we want to prevent. I want to acknowledge that any suspected case of cerebral venous sinus thrombosis, or CVST, and that is the technical name for this rare complication, needs to be submitted to the Vaccine Adverse Event Reporting System, or VAERS, and evaluated by CDC. I think you recall that when we began talking about vaccination, one of the things that we mentioned was the fact that we have a very, very strong post-licensure safety surveillance system. And the vaccine adverse event reporting system is part of that. Part of the reason for the pause was to stimulate reporting of any additional cases of CVST. And so we are referring any suspect situations to be reported to VAERS and to CDC for their evaluation, and we have done that. If you received the J&J vaccine more than a month ago, any of the associated symptoms would have already presented if they were going to develop at all. So at this point, we would say that you're protected and you should not need to worry. If you have received the J&J vaccine more recently, that is within the last 3 weeks, and you develop a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination, please contact your healthcare provider or go to the emergency room or urgent care and let the healthcare providers know that you received the J&J vaccine. And with that, I will turn it back to Commissioner Malcolm.
Thank you, Chris. Well, we've invited a couple of guests to join us today to a good milestone in the state's vaccination effort. As you've heard us say so many times, our push to vaccinate Minnesotans and end this pandemic requires extensive partnerships in many communities. We're very thankful for the role that Minnesota's federally qualified health centers play in helping us to advance our goal to immunize for impact. These clinics serve some of the communities hit the hardest by COVID-19, who have experienced not only in many cases higher case rates, but even more so higher hospitalization and death rates. We're very, very thankful for their service in protecting these communities from further impact and helping us get closer to the end of this pandemic. We're about to pass a milestone of 100,000 vaccine doses going out through that partnership with these federally qualified health centers. And we've invited Jonathan Watson and Ann Niakundi to talk to us a little bit about the very important and encouraging work they're doing and how we're working together to serve Minnesotans. With that, I'll turn it over to Mr. Watson.
Thank you, Commissioner. Good afternoon. My name is Jonathan Watson, and I am the CEO of the Minnesota Association of Community Health Centers. We represent the state's 17 FQHCs that serve nearly 200,000 low-income Minnesotans throughout the state. As the Commissioner alluded to, today we mark the delivery of COVID-19 vaccine dose number 100,000 from Minnesota Department of Health to the state's community health centers. I want to express my gratitude to Governor Walz, Lieutenant Governor Flanagan, Commissioner Malcolm, and the MDH staff that have brought us to this important milestone here today. Since the onset of the pandemic, Minnesota's health centers have tested over 60,000 patients. The positivity rates in these tests are 3 to 6 times higher than statewide averages. This comes as no surprise as low-income, geographically isolated, and BIPOC communities continue to experience adverse health outcomes. Unfortunately, the pandemic was no exception to that trend. Starting in January, Commissioner Malcolm and the Department of Health made a commitment to provide the state's 17 health centers with an ample supply of COVID-19 vaccines for both health center staff and patients. This supply complements the federal supply for health centers recently announced by the Biden administration. Without question, MDH delivered and continues to deliver on their promise to ensure that health centers can vaccinate low-income and BIPOC communities throughout the state. Health centers are uniquely positioned to test, educate, and vaccinate low-income communities. Since mid-January, health centers are averaging nearly 8,000 to 9,000 vaccines per week. This simply would not have happened without MDH's support. To offer an on-the-ground perspective and why this milestone is so important, I'd like to turn over to Ann Niakundi, CEO of United Family Medicine located in St. Paul.
Thank you, Jonathan, and good afternoon. My name is Ann Niakundi, and I am the CEO of United Family Medicine, an FQHC located in St. Paul that serves nearly 16,000 residents. United Family Medicine is a critical access point for primary medical, dental, and behavioral health services for low-income families and Black and Indigenous populations communities. Our deep history as a trusted community provider, combined with the supply of vaccines from the Minnesota Department of Health has enabled United Family Medicine to administer nearly 10,000 COVID-19 vaccines since the first of the year. Roughly a quarter of our own patients are now fully vaccinated. As a community health center, our model is built upon breaking down barriers for our patients to access primary care services. The pandemic has once again shown that health centers live at the intersection of public health and primary care. United Family Medicine is not only a source of vaccines, but a source of trusted information for communities that have had an aversion to vaccines for legitimate reasons. Our staff at United Family Medicine understand our patients' needs, and by meeting our community where they are at, we can allay fears our population has about the vaccine. A couple of examples come to mind that I recently experienced when working at the FQHC. At one of our vaccination sites at the clinic, I spoke with an African American pregnant woman who was unsure about the vaccine for valid historical reasons. But a conversation with her doctor about the safety of the vaccine prompted her to get vaccinated right away. At one of our outreach sites at a local church, thanks to the partnership with the Minnesota Department of Health and funding, we've been able to connect with an African American gentleman who had similar concerns about the vaccine. But after speaking with our outreach workers partnering with the church, he made up his mind to get vaccinated so that he can, in his own words, be there for his family. These and thousands of other stories, not only at United Family Medicine, but at all of the state's 17 FQHCs, demonstrate the trusting relationship health centers have built with communities since the Civil Rights Movement. As part of the Community Health Center Network receiving dose number 100,000 this week, it is an emotional milestone for our community, our patients, our staff, and as an African American woman, for me personally. I want to thank Governor Walz and Commissioner Malcolm for this support. Thank you, and I'll turn it back over to Mike Schumer at this point.
Thank you very much. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. And to withdraw your question, you may press the # key. The first question comes from the line of Jeremy Olson. Jeremy, your line is now open.
Thank you. I just wanted to, I've asked this question before, but things change from week to week. It's been about 4 weeks since you had said, Commissioner, that we're going to know the impact of variants on Minnesota in about 4 weeks. Well, here we are. Like I said, the case number today was really big, and yet some of the hospitalization and positivity numbers ebbed off just a little bit. So I'm wondering what you're forecasting. Are we in the middle of an exponential increase? Are things about to get better? Where are we poised to go?
Well, thanks, Jeremy. Yeah, this is Jan. And I do think that we are still really in precarious territory. We haven't yet seen the rate of growth turn exponential, but the curve, the epi curve that we look at all the time, it looks eerily familiar to what we saw in November. The case growth at this point is a little more measured, but it's still very significant. A 60% increase in cases just in the last 2 weeks is pretty concerning. We do think that this is variant driven, the uptick in the rate of cases, and the fact that hospitalizations are now showing a steeper increase as well is what we have seen previously. I would ask Chris Erzman if she would like to comment further on the sort of changing makeup of the cases and the hospitalizations. Your note on test positivity actually is, I think that's an artifact of we have had some additional test results come in recent days, dating back a couple of weeks to the end of March. So that ended up kind of dropping the calculated values for test positivity. So what I see in the data lag period, though, is the test positivity rate continuing to increase. So I'm afraid that the risk indicators still look like they are worsening, not leveling out, certainly not getting better yet. So, Chris, anything you'd like to add?
Yeah, no, I would just reiterate that, yes, all of the indicators and the metrics that we're looking at are continuing to go in the wrong direction. and as the commissioner said, even in the lag period. So that tells us that they're only going to get worse. It's not that, we're just waiting to see if they drop off. No, they're already increasing even before we have all the case data in. And I had the opportunity to unplug and take some time away. And I can tell you that being gone a week and leaving when our hospitalization numbers were in the 30s and 40s for the 7-day rolling average, and our ICU admissions were about 10, and then coming back and seeing that we were in the hundreds for new admissions, and our ICU admissions had gone up, to 18 and 20. I mean, that's really striking. And I think sometimes, you don't realize what's happening when you're in the middle of it, but when you actually step away and then take a look back, it's really concerning. So I would say at this point, what do we know about variants circulating in Minnesota after 4 weeks? We know that they have really driven our case numbers up, that they continue to be concerning, and that our hospitalizations, what we're seeing now is we're seeing hospitalizations in younger individuals. In people under 60, which is concerning as well. So yes, I would say that with 4 weeks of information, we are concerned about what we're seeing related to variants.
And I also wanted to ask, I hate to make an extreme incident stand for something bigger than it is, but there was a very bizarre arrest that occurred in Hutchinson of a man who refused to wear his mask at a Menards and then allegedly assaulted someone and then tried to flee from a police officer and dragged that police officer along with him. But it all stemmed from a mask issue. And I wouldn't want to make that stand for it too much more, but yet I wonder if it reflects just exasperation with masking, and if there's a need, what your reaction is to that, I guess.
Well, it's certainly an unfortunate story, and we do. You heard the governor say this earlier today. We do continue to feel that the mask mandate is a very, very important thing. It is one of the most effective things we can do, in addition to vaccination, to get people protected, to keep people protected, and to help stop the spread. We believe that we're grateful that the great majority of Minnesotans do continue to comply with the mask mandate. We understand the weariness with it, but the risk of transmission, especially with case counts and viral activity being this high, is really clear. So we just really, again, want to encourage Minnesotans to keep doing the things that we know work. And it's not just a matter of your own risk tolerance for your own illness. It's a matter of protecting our loved ones and our neighbors as well.
Thank you.
Next question comes from the line of Chris Magan. Chris, your line is now open.
Thanks. For the commissioner or for Director Erzman, do you know how many Minnesotans who've been vaccinated have then gotten tested positive for the coronavirus, have caught COVID-19 after vaccination and had a severe case or a fatality?
Chris, do you happen to have the current breakthrough data?
Yes, I do actually. And so just to clarify so that people understand what the definition of breakthrough is that is someone who has completed the full vaccine series. So you need to have had 2 doses if it's a 2-dose series, and you need to be 14 days after your last dose in the series. And then once you're at that point, if you would have a confirmed case of COVID, it would be considered a breakthrough case of COVID. So at this point, we've had 561 cases that have been determined to be breakthrough cases. Of those, 66 have been hospitalized, 9 have been admitted to the ICU, and there were 6 deaths. And just to give you perspective in terms of the deaths, the age range was 69 to 92. Cases admitted to the ICU was 44 to 90, and for hospitalized cases, 23 to 95. So those were the age ranges. And then just keep in mind the number of Minnesotans who have received the full vaccine series at this point when you look at those numbers.
Okay.
So that's out of millions of people vaccinated.
Mm-hmm. So just to follow up on that, do we know whether or not those are variant cases, or I know that your data on the number of variant cases is limited due to the sequencing that needs to be done, but do you know whether or not there are variant cases, or what is your suspicion when it comes to the variant and those people that are getting infected who've been vaccinated?
We have, some data on sequencing, but we don't have complete data. So we're working to make sure that when we hear about these cases, that if it's possible to get information or specimens for sequencing, that we do that. But we have had, 37 of those specimens that have been able to be sequenced. So again, yes, we have seen situations in which the variant, has been sequenced in these individuals, but I think it's important to put it in perspective that we're not able to sequence every situation. And so we have to look at the data with that limitation in mind.
You said you've sequenced 37. How many of those were actual variant cases?
We've had 15 that were identified as variant cases, and 22 could not be sequenced. So 15 were identified as variant cases.
Thank you so much.
Next question comes from the line of Catherine Richard. Catherine, your line is now open.
Hi. So I wanted to find out how concerned you are about hospital capacity, particularly with news this week that St. Joe's is actually winding down its inpatient COVID-19 care. Do we have the capacity? I mean, are you at all concerned about capacity at this point?
Hello? Mr. Malcolm, are you on mute?
Yeah, I'm sorry, Chris. Thank you. Yes, I was on mute.
Okay.
When you're not here to correct me, I get in trouble. The hospital bed situation is definitely something that we're monitoring very closely. My understanding is that beds won't be reduced at St. Joe's if capacity is a concern. So everyone is watching the cases and the bed capacity very closely. That will happen eventually, but the timing of that, my understanding is, will be moderated by what's going on with the pandemic. I think just in general, our hospitals have been collaborating with each other extraordinarily well. The process that we have in place for helping to refer to it as load leveling among hospitals needing help transferring patients to the right level of care and so forth, those processes are in place. To our knowledge, at last report, only one hospital around the state was in a position to need to start rescheduling other care in order to make way for COVID patients. So we're still in a very different situation than we were in last fall, but everyone is certainly on high alert. And we've talked about the surge beds that are available, and we still have quite a good supply of surge beds available in the state.
And I was hoping I could get your reaction to the Minnesota Medical Association statement that just came out right before the call here, basically citing, increased capacity in hospitals, very concerned about that, and encouraging anyone who hasn't been vaccinated to refrain from doing activities that could potentially spread the virus. And yet, some of the very activities, like wrestling, for instance, that are allowed right now are among people who can spread the virus, namely kids who can't get that vaccine or, might have trouble finding a Pfizer vaccine quickly if they're of age. So I guess I'm just wondering, how you might respond to what they're saying, but then also just the fact that, yes, we're seeing cases rise, and yet we're continuing to allow activities that are perpetuating the activity, the case activity.
Well, I wasn't aware of that MMA statement, but I always appreciate them weighing in, our health professionals weighing in on their perspective. I guess I would say, we have been advising, and we will continue to advise that folks who have not been vaccinated and folks who are at higher risk should think really carefully about the activities that they're doing, even though they may not be prohibited. We still are urging people to make good decisions. With respect to the transmission among school-aged kids and school and youth activities, that's precisely why we're encouraging testing so much in that population. Certainly, we will be working with schools to get the vaccine to those younger people who are eligible, the 16 and 17-year-olds. That will be a priority in coming weeks. But that's precisely the reason that we think that testing is so important for young people who are participating in activities. We really strongly urge at least weekly testing for kids who are participating in those activities.
And do you guys have any numbers around, whether people are actually doing that, whether it's school by school, or any numbers around those kids who went to the wrestling match and whether they're getting tested after the fact?
This is Jana. I don't have those data, but Chris, I don't know if you do.
Yeah, we don't have a complete ascertainment of everyone that attended, and that's why we're, putting out the word that we're encouraging testing for anyone that did participate. But as the commissioner said, that's a specific request for those individuals and families who may have been part of that event. But our recommendation is that, any youth who is participating in sports or extracurricular activities should be tested regularly for their benefit and for the benefit of their team and school.
But just to be clear, you guys aren't tracking specifically the number of tests of kids who fit that profile that are getting tested regularly?
No, we don't have that information.
Okay.
We know, 29 cases, 13 schools.
Thank you.
Next question comes from the line of Ben Goldberg. Ben, your line is now open.
Thank you. Thank you so much for doing this. I want to go back to the J&J issue for a second. I know there have been many states have considered using J&J for harder to reach populations because it was one dose, whether it's homeless populations or homebound people. Can you speak to any logistical recalibrations that you might have to be doing now that it may be at least a couple weeks before J&J comes back online?
Well, there is a great deal of work, this is Jan, a great deal of work going on with all of our vaccinator providers around the state and with our team at the Minnesota Department of Health, trying to help plan and shifting things around as can be. But it is a series of dominoes. Obviously, we very much regret the clinics that had to be canceled on short notice because of the pause in Johnson & Johnson, and that will continue to be an issue in the coming couple of weeks for vaccination strategies that had been planning to use J&J. So we're just hopeful, as Director Ehrson said, that this review will be thorough, but that we'll have some clarity sooner than later, and be able to resume use of J&J with all the proper alerts and outreach to providers to help them know what to look for and how to treat these very rare events.
If I could ask, what would it mean if you couldn't, or if ACIP took, said we need a month or 2 months? I mean, what does Plan B look like?
Well, it would slow down our expansion efforts, to be sure. At present, J&J, I think is, Chris can correct me if I'm wrong, I think J&J has to this point only been about 5% of our vaccine supply. But that was what was projected to grow significantly by the end of this month and into next month. So if that slows down, our progress in getting toward that 80% goal that we have of all Minnesotans vaccinated would just take longer than it otherwise would. But we're grateful, of course, that the supply of Pfizer and Moderna has been stable, but there's no denying that a slowdown in the supply of J&J will slow down our efforts at some point.
And Commissioner, if I could just add that, everything that we've heard from our national partners and from the deliberations of the ACIP suggests that they recognize the important role that this vaccine plays in our COVID pandemic response. And so at this point, our anticipation is that as they have more information and more time to look at it closely, that it's likely that, as the commissioner said, they will be providing more refined recommendations on how this vaccine could be used. We have not heard that the direction might be that the vaccine, would not be used at all. Obviously, we'll wait until the meeting that happens next week, but right now we're anticipating that we'll get more refined guidance.
Thank you very much.
Operator, we have time for one more question.
We have a follow-up question from the line of Jeremy Olson. Jeremy, your line is now open.
Yes, regarding the breakthrough cases, Chris, at one point you said you were doing some review of those to see whether they were due to any bad lots or incorrect administration. I just wanted to check on those numbers and find out if they're all just because the cases broke through the vaccine, or whether that was due to any incorrect administration or anything like that.
That's something that we're looking at. We have not identified a particularly problem situation at this point, but we have got the team that is looking at breakthrough cases. They are connected with our team that works with our vaccine storage and handling administration and things like that. So we've got the teams connected so that if situations are identified, that we can do the necessary follow-up, residual training, that type of thing.
Okay. And then I wanted to also Commissioner, I had said something to you incorrectly earlier regarding the State High School League. Their advisory panel has they're asking the health department to permit outdoor competition without masks. So they're kind of putting it in your court, so to speak. And I wondered if you had any reaction, since you're ultimately being asked to permit outdoor sports, this high school sports this spring without masks. Do you have any thought or a decision on that?
Well, thanks, Jeremy. I just became aware of that as well. And I have not seen their actual letter yet, so I've not had a chance to look at specifically what they are suggesting or requesting, whether there are any conditions to that. I do believe, as we've been talking about, that with the degree of viral activity and the role that we know that youth activities are playing in transmission, I would be very reluctant to see masking not still in use unless we've got this really strong testing regimen in place that we've talked about. So I'm perfectly understand that particularly as the weather improves and folks are outside, that there are questions about why masking remains important. But even though outdoor activities are safer than indoor activities, they're not without risk. And with these variants moving around and the level of case activity, we're at this point, we're still, very much encouraging mask use.
Thank you.
That is all the time we have for today. I want to thank our guests for joining us. If any reporters have additional questions, please feel free to reach out to our office this afternoon. Have a good day, and we will be back with you again soon.
Thank you so much to our presenters and to everyone who participated. This concludes today's conference call. You may now disconnect. Have a great day.